My name is Damianus or Nyakinye, but popularly known as Japolo. I'm a clinical officer by profession. I work at Lwala Health Center, and that's where we are right now. Anemia is a very big case here. One, it's because of elements, that's worms, malaria, and few cases of complicated deliveries. Yeah. So wide range of cases that we do meet that we were not actually able to handle here. But the good thing is that with consultation and CMEs, we are able to do the diagnosis and refer as soon as possible. 1 year since I got here in August, and then in September, right away, I had one iPod, and there were iPads that were circulating around. So I still have that iPod with me. It's like my cell phone, but people really don't know. Some people really think it's cell phone, but it's a great thing. It helps me a lot. I use it every day. I use it beyond the hospital. You know, medicine is a science that is ever changing. You have to keep up with the modern medicine. It's not something that if you are taught 30 years back, it's still what is being practiced now. With the iPad, you're able to update yourself, you're able to teach yourself plus the patients, and it's an evidence-based tool that you use to show actually this is what I'm doing, this is the kind of patient I have, this is the kind of management that people have used or that has been proven, and it just makes your life easy plus the patient. You don't need to carry big books to consult, and it's quick, and it's something that's right there with you. One is I started with the rheumatoid arthritis, a classical rheumatoid arthritis that I treated for a prehypertension. The patient wasn't improving. I treated for bursitis. The patient wasn't improving. So one of the Vanderbilt medical students came and borrowed an iPad from the laboratory from Mike and started clicking the symptoms and looking it up, and told me like, there's a Skyscape in that small iPad that you are holding. It's not using any internet access. So I started clicking, and then he was looking at hypertension, diabetes, and gouty arthritis, and I clicked at rheumatoid arthritis, and we started looking at the classical signs, and then we left the hospital at around 2 p.m. and visited this mother at home. And right now, as I tell you, she's able to walk, she's able to carry on with the daily activities, and from there, I've been able to know we sometimes treat people with what we think, not what we are really sure of. But with the iPad or with the Skyscape, if you are not sure of anything, you are able to confirm it. And I really confirmed that day that this lady had rheumatoid arthritis, classical with the rheumatoid nodules, something that I thought they were swollen in the joints, and I thought this was just pus. So with antibiotic, this would go. But 2 weeks, this woman had not improved. But after researching that, I looked into some of the medical books we have here in Kenya. It was shallow. I Googled, I could not get a clear, something that is well comprehensive, well organized. So you look at the way the books in the Skyscape, the iPad are all well organized, then it's not just one book. You're able to compare this, and then you're able to make a very good conclusion and you make good decisions using the Skyscape.